Verona Murphy.
Deputy Verona Murphy, yes.
Thank you, Chair.
Sorry.
The regional group
of
the regional group as opposed to party.
Sorry.
Not at all. Deputy Minister Donnelly, may I first congratulate you. Job I'm sure that you're looking forward to doing. You most certainly have the ability and the insight, and you've displayed that as spokesperson for the last number of years. So I wish you well. I hope we'll work well together. There's some issues that do need covering, particularly in Wexford, and I'll get straight to them. So you've heard from deputy colleagues that mental health is in crisis and unfortunately being reported currently as a tsunami. And I would say that if we don't halt that tsunami, the devastation that will ensue will be with us for generations as destruction. More and more people's mental health is being compromised due to the poor domestic situations exacerbated by staying at home, the current COVID crisis, life pressures, no jobs but bills to pay, and those already within the mental health system. Some frightening statistics, Minister, published of late. The National Spinal Injuries Clinic's latest report states that there is a 17% increase of injuries sustained through suicide attempts in March and April of 2020. It's up from 1% last year. Those numbers would seem to reflect a trend being seen elsewhere. The College of Psychiatrists of Ireland concluded a survey of 615 consultants, a third of which said there was both new onset and relapse patient cases on the increase. Of particular concern for the mental health are the younger generation and the older generation. In March and April of this year, the Mental Health Commission reported a rise of 7% on last year of involuntary admissions of mentally ill people by An Garda Síochána, most under 30 years of age. In November 2019, the Oireachtas Committee on Mental Health heard that there was 2,600 fewer staff in mental health services than recommended by the government's Vision for Change. Yet, in the recently published 10-year roadmap called Sharing a Vision, 14 years on from the last roadmap, Vision for Change, yet this roadmap contains no costings or details of staffing levels for the next 10 years. In Wexford alone, our CAMS unit doesn't have a child psychologist, it doesn't have a dietitian for a child or otherwise, and it has a part-time occupational therapist. We are seriously letting our children down. The CAMS unit in Wexford has just recently moved into Arden House. Yes, it is a very new, fresh building, and everybody is absolutely thrilled. But it is not going to provide services unless we get a dietitian. Believe it or not, Minister, 3 months ago, I'm aware of a child psychologist putting a CV into the HSE, applying for the job in Wexford. I have persistently been told by the HSE that money is not the issue, finding an applicant is the issue. In the 3 months since she's applied, she has not even received a response to say that her application has been received. There is something very, very wrong, and I hope, as a minister who has for 3 years understood these issues, you yourself said in many, many interviews during your election campaign that you would invest €200 million in our mental health services. But if this isn't and hasn't been a money issue, why has that child psychologist not received a response for a job that is so badly needed? I get calls every day from parents of children who need these services. And the one thing they keep repeating to me is words are no good. It's no good on paper. What we need is action. And I'm delivering that to you, Minister, and I'm asking you to take action. I have no difficulty sitting down with you to discuss the CAMS unit, to discuss the mental health services in Wexford, and I'd welcome your intervention to make progress with the HSE on this matter. The other thing I really want to mention today, and it's something that's of grave concern, not just because of the programme last night that RTE Investigates did, it has been something that is brought to my awareness from a local daycare centre who received very little funding, but funding nonetheless from TUSLA for bereavement counselling for our elder citizens. Unfortunately, TUSLA no longer is going to make that bereavement grant available. It has been transferred to the HSE, and there is a very arduous process involved. We can see from last night's programme and from the COVID crisis, we all have parents, we know what they have been through. It is imperative that that bereavement grant is made available as a matter of course, Minister. We do not need to continue to show disregard for our senior citizens. We must take the actions that are required, and I think many of them are in their latter years. They need bereavement counselling to give them a peace of mind, and I'd ask you to undertake to oversee that, or that you might even write to me and let me know that the procedure can be, if one of the care centres has been in receipt of bereavement funding, it should just simply be a matter of another simple application, and the funding should be received. The New Houghton Hospital in New Ross. The junior in your department, your predecessor Minister Jim Daly, visited New Ross with me, and I would say that funding had been granted, but unfortunately it has not been furthered. Again, this is a facility that mainly cares for dementia patients. It is invaluable in our community, and I mean invaluable, and through the whole of the COVID process it has been invaluable, and the staff are just wonderful. What is happening at the moment is that there has been no COVID in the hospital, but they certainly need to get that funding, and the maintenance needs to be carried out. And I'd ask you again that you might give me an update on that, Minister. In writing is no issue. I have had many family members contact me in the last couple of weeks, and I know that some nursing homes, more private than otherwise, have instituted visiting now, albeit that in some cases it's outside for 15 minutes or so per patient. But many people are not necessarily being denied access, because I very much understand the plight of the nursing homes in relation to having to keep their patients and residents very secure. But I would ask you, Minister, are there going to be guidelines in relation to visiting, and when we will have a safe period, and what kind of direction and help you can give to nursing homes, private or public, so as that they may need more assistance. It may be financial requirements, it may be that they don't have the capacity to deal with outsiders coming in with all of the regulations, all of the requirements that are being provided in social distancing. But I would ask that many people are now asking to see their loved ones, and they're in an age bracket whereby they very much need to interact. So just those things, Minister. We'll have lots of issues to discuss going forward, but I hope that many of them we can take immediate attention to, particularly the CAMS unit in Wexford. And all I request is a short meeting so that we can sit down and work out, if it's not a funding issue, where we can go to further the cause for the young people of Wexford. Thank you.